Welcome back. In this video, we'll talk about the diseases that can cause vertigo. This includes Meniere disease, benign paroxysmal positional vertigo, and multiple sclerosis. Starting with the most common, Meniere disease, it's caused by hydrops Endolymph, which means that there is excess fluid within the inner ear. These patients will keep having attacks of vertigo, and these attacks can range anywhere from half an hour all the way to 1 day. We see it mainly in adults, and it's very common to have sensorineural hearing loss. So these patients must have a baseline audiometry check and routine annual audiometry tests. You should also do MRI to exclude vestibular schwannoma. Speaking of which, vestibular schwannoma is a tumor in the auditory nerve, but unlike Meniere disease, the tumor will always be present, so the symptoms will also always be present. And just like Meniere disease, the patient will have hearing loss as well as vertigo. Bilateral vestibular schwannoma is indicative of neurofibromatosis type 2. Next, we have benign paroxysmal positional vertigo, and it's caused by debris within the inner ear. This can be keratin, dead cells, or small bone fragments. This causes recurrent attacks whenever the head moves, and the attacks are very benign. Well, from the name, they're less than 1 minute. It's important to know that hearing will be intact, unlike Meniere disease. Next, we have Endolymph fistula, and this is caused by barotrauma. In other words, it happens if somebody had sudden increase in pressure or sound, such as if somebody had an air horn blown right next to their ears. These patients will have vertigo attacks whenever the pressure in the head increases, for example, in sneezing or in Valsalva maneuver. The vertigo can also be triggered by loud noises, and this is called Tolio phenomena. Next, we have labyrinthitis, which is basically inflammation of the inner ear. These patients will have persistent vertigo and sensorineural hearing loss for many weeks. These symptoms will be constant, and they'll stay there until the inflammation resolves. Next, we have vestibular neuritis, and this is a viral infection of the vestibular nerve. These patients would present with common viral symptoms, which would then resolve, and then they'll have a single, very severe attack of vertigo. Once this attack resolves, they will not have a recurrence. And finally, we have multiple sclerosis. This causes vertigo by demyelinating the cranial nerve number 8. So expect vertigo with hearing loss, plus other multiple sclerosis symptoms. Alright guys, that's all I have. Thank you so much for watching, and hopefully this helps.